So Dawnn, if you tell us a little bit more about the work that you do at the foundation, and then I want to get into the question particularly around what you found interesting in these data and the findings that we're going to go a little bit more on the barriers to finding and keeping a job. So tell us a little bit more about the work that you do at the foundation.
Yeah, thank you. So I wear a couple hats at the foundation, but in this conversation, as relates to jobs, I staff a funding collaborative whose name is Reimagine. We are going through a re-envisioning ourselves, but we were formerly known as the Greater Washington Workforce Development Collaborative. And it's a funding table for institutional funders, for individual donors, and it was created back in 2008 when the region was experiencing high unemployment because of the economic recession. And these funders who came together wanted to do something differently. And there was always early recognition that as it related to high unemployment, that we couldn't just have programmatic solutions, that there needed to be an investment in some systems changes in order to get to the results, right? And so these groups came together and decided to pull resources in which to do that. And so the collaborative has invested in research and advocacy and successful practices around achieving population level results as it relates to work. And so that was sort of the journey that brought us together back in 2008. Then as we know, COVID happened. And as it relates to COVID, for all of us, COVID changed work, right? COVID changed how we work. What is work? And it also changed the conversation about work in the workforce development space. And that seems to be such a nebulous term, workforce development. I hate that term. But in the workforce development space, that conversation had also changed drastically. And so we, as a collaborative, stopped and said, the conversation has changed, we need to change, and started also engaging in a listening process, where we're talking to those who are working closer to the ground and talking to government, and really figuring out how did we need to shift. And something that came through those conversations was the need to really refine this tool of jobs to better utilize it as a tool for economic justice. It is a lever for economic justice. But right now in its current state, it's not achieving that. It's not helping achieve that for our neighbors. And so that was really a theme that came out in those conversations and caused us to reflect how we needed to shift, how we were structured, how we showed up, how we supported our philanthropic partners and our neighbors. And so I lift that up because it's sort of linked to why I wanted to talk about the barriers. Not that these are barriers that are new, not that they're unfamiliar to us, but just to highlight the points that Tonya started off and that you all shared in your panel about the need to really get out of this tendency to only focus on programmatic solutions when we're talking about these issues. Our residents, our neighbors are still encountering some challenges. And so how do we have a more systemic approach? How do we support as philanthropy, as government, systemic responses to what our residents are experiencing firsthand and what we're hearing from them? And so that's, yeah.
So Dawnn, we see that like 1 in 5 or close to 1 in 5 are citing past work experience or lack of education and training as that barrier that's holding them back. So tell me a little bit more about that. What does that systemic change look like, particularly around those two levers, right? Those are the most common cited barriers that we got from overall from residents is past experience and education or training being that barrier for them.
Yeah, when I looked at that finding, I thought it was really interesting. Something that came up for me was a conversation that's been happening a lot in the job space around competency-based skills. And so there's this conversation where, in workforce, there's sort of this default to a 4-year degree. Someone has a 4-year degree, that means they directly have the skills and experience in order for a job. And there's been a lot of conversation that that's not the case, that 4-year degrees are not the proxy. And so when I looked at that data point, something that rose for me is especially when folks were saying that their past experience was a barrier, how can we also in work think about when folks are in transferable skills, when folks are in jobs and they are applying skills for one industry, how can we make those connections into other industries, right? And how do we create sort of that bridge from one industry to another? And that's what's happening in the job space. Folks are thinking about in industries such as retail. How can folks who have skills in the retail industry be transferable to other industries? And how does the system then encourage and allow for those connections so folks can easily transition within different industries?
Okay. And last question for you. So one of the things that was surprising for us when we initially looked at some of the top line was like, access to childcare was not this high number. But then we kind of peeled back the onion a little bit and went to that layer of those who had children in their household, and it being the biggest barrier that's cited, so access to childcare. So you talk a little bit about what that looks like in terms of the work that you're doing and this ability to kind of remove that barrier, right, for those who have little humans in their households, right?
Yeah. And you know, the childcare piece really stood out to me for a couple of reasons. One was really interesting. Childcare has been a challenge. It's been a challenge even pre-COVID. And when you talk to the childcare industry and early childcare professionals, they have been knocking on the door of the workforce system and been ignored. And they've been knocking on the door for two reasons. One, they've been knocking on the door because they said, as an industry, we need help. We know our wages are low. We know our model's not working. We need some help. And also as a work support, like we need to be a part of the conversation because workers have kids. But what COVID did was it just caused the system to pay attention to childcare in ways that, in my opinion, we hadn't been paying attention to. And so childcare is now being invited in terms of, in the conversation, I would say in multiple different facets, but one as an industry, and especially when you look at the number of Black and brown women who are occupying the childcare space. Now we're talking about the public workforce system, thinking about how as a system is our responsibility to help this industry increase wages. You're in the business space, in the small entrepreneurship space. There's conversations about how they can be a part of the conversation in addressing the model of childcare as it relates to as a small business. And then as a work support, how do you include childcare and keep childcare in the conversation, because it is a key lever for individuals and helping them to engage in their job. And something that I think is from a system response is very interesting. And it's not the be-all, but it's one step. There's lots going on. As we know in this city, there's conversations and work around increasing wages for childcare workers, which is really important and significant. And also, from nationally, when we're talking about models like apprenticeship, childcare has not been in the conversation historically. When we talk about apprenticeship models and how they work, where you can earn and learn at the same time, we're talking about construction, you're talking about healthcare. I think for the first time, there is an early child care professional that's on the National Apprenticeship Council that's a part of the conversation about how childcare also, how can we include that industry when we're talking about apprenticeships. And so these are some of the things I think that stood out for me. And you see, we kind of went rogue. There wasn't the child care data up there, went a little rogue, but just thought, because it's just, and it's so present in the conversation right now, that wanted to highlight that. So thank you.
All right, Jennifer, so tell us a little bit more about the work that you're doing around partnership to end homelessness, and what you're seeing in these data that is particularly insightful for you in the work that you're doing, or that's encouraging.
Sure. Good morning. So I work at the Community Foundation on our Partnership to End Homelessness, which is a partnership between the Community Foundation and the DC Interagency Council on Homelessness. If you're not familiar, that's a body that coordinates DC agencies, nonprofits, people with lived experience, and advocates. And a few years ago, we realized that the people that were missing from that table that was coordinating all of the work to end homelessness in DC was the private sector. So philanthropy, corporations, individual donors were not coordinating and aligning in the same way that the work was happening at the ICH table. And so the Community Foundation, along with the DC Interagency Council, launched the Partnership to End Homelessness with that goal of really aligning and coordinating the private sector around the city's plan to end homelessness. So as you can imagine, we launched in 2019, and we were all excited, and then pretty quickly the whole world changed. The pandemic happened, and I think a lot of what we're seeing in some of the data that we're looking at now, especially as we look at the numbers this time compared with 2020, is a reflection of the pandemic. Both the pandemic response and the fact that there was a flood of resources available pretty quickly, and the fact that many of those resources are gone or quickly dwindling. So I think it's up here. Yes. So you look at the data point behind me around people worrying about paying their rent or mortgage. And we see that this year or last year, about 50% said that they were worried about that. But when we look back to 2020, it was about 30%. So it's alarming in its own that 50% or around 50% of people are worried about this, but the fact that it's increased so much over the past few years, I think is especially concerning. It's not up here, but also in the report, you'll see that more than 1 in 10 residents that responded said that there have been times in the past year when they didn't have the money to provide adequate shelter for their family. So they weren't just worried about it, but they really could not afford to pay for adequate shelter, which is extremely alarming. And we see these trends reflected in the data around people experiencing homelessness. So we just saw the most recent point-in-time count, which is the annual count of people experiencing homelessness in the region. And this year, or over the past year, we have seen over a 12% increase in the number of people experiencing homelessness in the region. It's the second year that that number has increased after trending downward for a little bit. And so I think what we're seeing here is kind of a reflection and leading to what we're seeing as it relates to people experiencing homelessness in those numbers. We know that people across the country are struggling to pay rent, and that over half of renters in the US are paying more than 30% of their rent, or their income on rent, which is by definition making them housing cost burden. We also know that the region as a whole is lagging in building affordable housing and housing in general to keep up with the number of people that live in this area. And the latest point-in-time count, the count of people experiencing homelessness, for the first time this year has increased above pre-pandemic numbers. So we're seeing people struggling, right? Maybe it's not surprising, but I think that these numbers really just highlight the struggle that we're seeing, especially as it comes to, relates to housing. And again, we're seeing a lot of the resources that became available during the pandemic are going away at a time when the cost of living continues to rise. Housing prices remain high across the region, and we just can't keep up with demand. I do want to point out that while we're seeing all of this, the homeless response system, so the system that actually is the one that takes care of people, helps people get back into housing, is actually growing and in many ways improving. But when we continue to see a growing number of people coming into the system, we just cannot respond to the demand, and we have not been able to grow that system quickly enough. And when we're investing in that system, we have to also be investing upstream and looking at preventing people from coming into the system in the first place if we're ever going to end homelessness in the region. I'll just say that I think that the fact that numbers went down during the pandemic is really telling and shows what is possible when we provide flexible, immediate investments. I won't say quite at scale, but at a larger scale than we have in the past or are doing on a regular basis. And that's really why through the partnership, we, from the beginning, and because we heard this from the community when we were designing and planning for the partnership, a big part of our work is really focused on both public education and advocacy and organizing, because we know that while philanthropic and private sector dollars have a really critical role to play, the public sector really has to be at the table and is really going to be the one that has to make some of these larger investments to really expand affordable housing and make sure that we can respond when people lose their housing and get them back into stable housing quickly. And I'll pause there.
So the follow-up question I have related to that solution, one of the discoveries or the highlight from the previous studies was this willingness among residents to help to be part of that solutioning for the problem of homelessness. So this year, that trend is less, so that we do see that a smaller percentage of residents are willing to, essentially pitch into that helping towards that solution, where they're less favorable, right, to the option of, helping to end homelessness through increased taxes. So we see a decline there. So when you think about the way that the problem has evolved, do you think the magnitude might be impacting residents' perception about, what it is that they could do to help solve a little bit more around this agency that residents may or may not be feeling in their ability to help solve this issue?
Yeah, I think that data point was interesting to me, concerning, because a lot of what we're trying to do is public education around these issues. I think in part we're seeing, the last survey was in 2020, when there was just this kind of swell of caring about your neighbor and wanting to be a part of the solution. And I think it's partially that some of that has gone away, frankly, and maybe people are struggling more on their own, and so they don't feel like they have as much to give. But I think it just points to the need for the support for the education and helping people understand, one, the solutions. I'll talk a little bit later if we have time about some of the other questions we were asked around homelessness, but understanding the solutions and feeling like you have an ability to impact and influence change and actually addressing some of those issues.
All right, so Darius, my turn to ask you the questions. So I wanted to tell me a little bit more about, for you, what are those data that kind of stood out for you, and as you think about the work that you're going to do next through your work at the foundation. So tell me a little bit about how these data are providing you the leverage that you need in terms of thinking about programming and investment into creating change.
Certainly. There is so much information in the report, and we put it under the heading of economic precarity or economic volatility. And one of the key findings is what you see here and in the report, which is around people's inability to afford basic needs, and including things like buying food for themselves or their families. So one of the findings is that about 1 in 5 people across the region said that in the past year there was a time when they could not afford food for themselves or their family. You also see it here when we look at the priority areas, which Camille and I talked about earlier, those specific neighborhoods and zip codes that the foundation is focused on, where there may be higher concentrations of poverty, lower home ownership rates, and the like. We see that number increases at a meaningful and significant standpoint. And this just really is troubling for a number of reasons. One, because we know that things like having the economic resources to buy food, one, it is about having the resource, which is the dollars to buy the food. But we also just know what impact it has on a person, particularly households with children, when children are not, fed and then are expected to go to school and to do well and to develop and so on. So although this statistic and this finding is really challenging on its own, it really just scratches the surface at the consequences if we do not correct this or make investments that really help people catch up and keep up financially. So a lot of what we're doing at the foundation is just that. We're focusing on economic mobility, helping folks build wealth. And one of the key ways, just one of the ways that we've done that is through supporting several guaranteed income programs. And the connection that has here is that we know from over 100 guaranteed income programs around the country, these are programs where people get unrestricted monthly cash payments, typically between $500 and $1,000 for about 18 months or 2 years or even more, but it's unrestricted cash payments. And we know from the data from these pilots that people overwhelmingly use the dollars to pay for things such as food, medicine, and safe and stable housing. Like, those are typically the top things that people use the money for. So for us, it's been an important way for us to bridge these sorts of gaps, help people make decisions for their families about putting food on the table, moving to safer housing, securing transportation, and so on. But again, I just want to reiterate, this number being challenging on its own just really scratches the surface of what happens if we don't make these kind of investments that give people the financial resources to make ends meet, but also to build savings so that if they have a rainy day, encounter some kind of accident, have a sudden bill, that they are not stuck in a perpetual cycle of financial struggle.
So I have a quick wrap-up question for each of you related to the area of focus, and I'll start with Darius here at this end. So when you think about the gap, because when we look at overall residents' overall well-being, the gap, that distinguishing gap between those who are thriving and those who are in our suffering bucket is this ability to meet your basic needs. So when you think about the work that you are doing to kind of fix those gaps, what does collective action look like? And, you know, what are those system changes that you're looking to do in order to kind of reduce that gap that we see? Because we know it's an important aspect for residents' overall well-being.
Well, I spoke a little bit about the work that we've done to invest in several guaranteed income pilots around the region. And we know that that's important for the thousands of people who have been a part of those pilots. They've had the opportunity to, provide food for their families, secure safe and stable housing, make other investments in themselves and their families. We have even bigger ambitions, which is to go from, to continue investing in these pilots, but to also think about how do we go from pilots to policy? How do we make these kinds of things like unrestricted cash payments something that is standard and not something that is still in the pilot phase as we see around the country. So I think it's thinking about some of these programs. Dawnn talked about sort of programs versus systemic things. And so like we're starting with the programs, but do want to make that transition to policy, and that's one way that we're tackling it. The final thing that I'll mention too is that there's a finding in the report about how people feel about their ability to transfer wealth or some kind of inheritance or asset to their children. And again, this note about food and basic needs is important because when you're stuck in that cycle, like you're not able to build, to buy a home or to buy something that then you could pass on to your children, and then it becomes this continuing disparity where families get locked into this cycle. And so we view these investments as ways that we can help give folks really a hand up and a leg up and sort of moving up the economic ladder.
So I love the question around collective action because that's why the partnership was created, was really because there was a recognition that everyone had a role, every sector, every person, every business has a role to play in ending homelessness, and unless we're all around the table, then we're never going to see the progress that we want to see. As I mentioned, we, through the partnership, have focused heavily on advocacy and organizing and policy change because we recognize that while with our limited philanthropic resources, we can pilot things, we can test things, we can build public will, we're never going to be able to invest at scale without the public sector really being at the table and really changing the policies and making the investments that we need. I mentioned earlier, I touched on earlier some of the questions we were asked around homelessness in the region and around solutions. And around 40% of respondents agreed with all the statements around whether they believed we could end homelessness or eliminate homelessness in the region, whether they supported extremely low-income housing being built in their neighborhood, and whether they agreed that increasing the supply of affordable housing was the solution to homelessness, which are all fundamental to the work that we're doing. And without believing these things and agreeing with these things, we're never going to see success. Interestingly, what we did see when we break those responses out by jurisdiction is that in DC, over half of respondents agreed with those statements, while less in the other regions, or in other parts of the region. And I think, in part that is because in DC we have a more robust philanthropic private sector support for the advocacy and organizing organizations that are really doing the education, the public will building around these ideas, and really building support for these ideas. And it's important that we have organizations and support that is not tied to the government funding, that is funding other pieces of their work, because it creates a conflict. So part of what we do, and I think a really important role for philanthropy and for individual donors, is to support those types of organizations that can help people understand what the solutions are, help them understand what it means for them and how they can be a part of the solution, and really then take that to the elected officials and tell them that this is a priority for us, this is important for us. You mentioned earlier people understanding how it benefits them, and understanding that when we end homelessness, it's good for everyone. It makes our community stronger, it creates the community that we all want to live in. So, yeah, I'll stop there.
See, I love being last, because you could just say ditto, ditto, ditto. So ditto, ditto, as it relates to investing in, advocacy, organizing, and system solutions. But the one thing that came up, Camille, when you asked that, and I think it's been said, and I think maybe even touched on more, is how do we really keep supporting and investing in the agency of people? Their voice and providing input, but how do we, there's this, in talking about racial equity, where in philanthropy, that's the hat I wear, thinking about how we step back and letting residents and those who are closer to these issues lead. And how do we invest in that? How do we support that? Because that is a key lever to collective action, right? Those who are closest to the ground, those who are closest to these issues, know what the solutions are. They're living it every day, they're interacting with it every day, and they know it. What they need is kind of, again, from this hat, philanthropy, investment, support, and for them to be the ones that are driving rather than philanthropy driving. And so that to me is, I think, a key ingredient and amongst many ingredients in order to get to that collective action.
You're just going to take my last question, Dawn, about the influence, because the slide that was up there about how residents felt in terms of their ability, the influence that they have. And so when you think about what does that look like to engage community and residents into the solutions that you all picked specific areas because it's where your work is centered. But what does that look like? What does empowering and enabling residents and community look like for each of the solutions that you all talk about across these areas?
Yeah, I mean, I think one thing is being intentional about engaging community. If you really want to engage community, that means they might say something that you might not agree with, and you need to be okay with that, right? So I think it's being clear about sort of your intentions and wrestling with giving up something. So I'm just going to start from a basic level because I know we're running out of time. From that, of just being clear, and what do you want to engage community on, and being clear again that if they say that this is what we feel is important, that might not align with you, and you, I guess, need to be prepared to lean into that discomfort and to support that.
What about you, Jennifer?
I love going after Dawn because she's like genius. So through the partnership, the way we've done this is we have really prioritized working with our partners who are people with lived experience of homelessness and people who are working on the ground to identify the solutions, because as Dawn said, they're best positioned to identify what is needed and what is most important and prioritize. And then we work with our leadership council and our private sector supporters, so business leaders, philanthropic leaders in the region, to support the asks that were in the priorities that were identified by our partners that are working on the ground and people with lived experience. And I think that is a way that we can both do what Dawn's saying in really leaning into listening to the community and engaging the community, and then using the influence that we have to recognize some people have more influence over decision making than others, unfortunately, to support those asks and to lift those up so that we're engaging the whole community, again, to identify and implement solutions.
And yes to all of that. And I think VoicesDMV is one way that we do it at the Community Foundation. In a little bit, I'll be talking about a new opportunity that we'll be launching that will do exactly what you're talking about. So looking forward to sharing more about that.
And then to wrap us up, my challenge to the room is, as you read this report, to not just take it as another input for data, but to also interrogate yourself to say, what will this insight allow me to do differently? Now that I have this insight that's direct resident experience or the voice of residents, how will this insight change the way I work when I go and sit wherever I work tomorrow, how does this insight provide me information that I can use and leverage to answer this particular question about, allowing residents to feel like they have influence in the decision-making and things that impact their lives. And with that, thank you so much to my esteemed panel for your insights and your love. And I will